So Scripps Health is a $3.3 billion health system here in San Diego County. We have 5 hospitals. We do about 75,000 to 80,000 discharges a year. We also have a medical foundation with about 35 outpatient practice locations distributed across the San Diego County. We embarked on a Community Connect program for 3 primary reasons. 1 was to grow volume and lives across our accountable care organization. 2 was to develop a linkage through the electronic health record for our patient community across the care continuum, ambulatory, acute, and post-acute. And then lastly was really to be responsive to our purchasers.
So what consumers and purchasers want these days is they want easy access to their physician and be able to find all their information on a single medical record. So having a network, a physician network on a common medical record became a major priority for our Scripps ACO to accomplish those things for our customers.
We had a goal for bringing 275 community-based physicians live on an electronic health record over the course of 3 years. The components of that were really to engage an implementation partner, which is Nordic, to help facilitate the actual implementation of the electronic health record. 2 was really using the ACO, the Accountable Care Organization here at Scripps, as the vehicle to deliver Community Connect. And then the final component was really the IS, or the Information Services piece here in the organization, as a key sort of support and infrastructure for the ACO to be successful in that outreach program.
So one of the very first things that we did as the ACO was look to create a Community Connect offering for our physician participants, establish what that offering would be, and then set out to begin to implement Community Connect within practices to achieve those outcomes.
We wanted to ensure that we were selecting those providers who were going to be the right fit for the program. And in order to do that, we really put in a lot of work up front. So we have robust processes and standard work that we follow all throughout the pipeline development process. Implementing a new electronic health record in a practice, even with a robust team that we're deploying, can be a big change for providers and for their practices. And so we wanted to ensure that we're supporting them throughout that process.
Having someone clinically oriented that is also a subject matter expert in Epic is key to the success of your Community Connect project. If you don't have a physician champion, the technical team will make many assumptions about how medicine works, and they will be invariably wrong. That will lead to workflows that at best will cause slight inefficiencies in how the practice works, and at worst, physician burnout.
We really wanted to make our providers more successful than they were today, either from a clinical workflow standpoint or from a revenue cycle standpoint.
I think the physician practices are most excited about the connectivity with the larger Scripps enterprise, and so the ability to seamlessly communicate information to other providers within Scripps, see information from the hospital. That really helps them feel like they're doing a better job providing patient care in their practice because they have all of the information at their fingertips.
Our Epic Community Connect project was a success really due to 3 reasons. In the beginning of the project, we engaged early adopter practices with the agreement that they would commit to share kind of the good and the bad and the ugly relative to feedback and input to us around their experience throughout the entire process. The second reason I think we were successful was the willingness to listen and take input and really try to understand the needs of our customers in terms of these physicians and what made their practice work and how we could really enable them to be successful in value-based care. And then the third reason I think we were successful was the expertise that we were able to get with the partnership with Nordic.
We really worked seamlessly together, everyone bringing unique perspectives and unique experience, and I think that led to the most robust program that we could have for the providers.
Without them, without that strong partner, we would not be where we are today.
The first piece of advice I would give would be to engage a consulting partner to help guide and assist you.
Make sure that you have really strong physician champions and physician leaders who are willing to help give candid feedback about what they think will or won't work. I would also say to really consider carefully the decision hierarchy that you're going to use to determine which practices are a priority for Community Connect.
I'm a big believer in standardization, but it is important to have some flexibility with these smaller groups.
Make sure that the expectations of what you're delivering to the clinics is very clear and everyone understands that. Make sure that you're following checklists for your go live, and everyone is rowing in the same direction.
What's been most powerful for our organization offering Community Connect has really been the firming up of the relationships with the practices. It's been an incredible learning journey for us, and one that I think we take a lot of accomplishment in that we're not afraid to continue to learn. That's really where the innovation and the excitement can come, is how do we continue to improve the product offering in a way that meets the unique needs of the practices and ultimately achieves the broader goals of the Accountable Care Organization here at Scripps.